But she went from feeling good to all of a sudden her hand's getting weaker. Her hand feels like it's losing sensation. Her arm is in pain. Her neck is in pain. She's up at night. She's holding her hand like, what's going on? I feel like I can't open a jar. She couldn't do certain things with the hand. And she's getting really worried. We tried different treatments with what we do, and it wasn't working. And then I got those samples of those shots. And I found that it was the Moderna. It was in her lymph. And she took that remedy, and in 1 hour, the 3 months of the problem with the hand disappeared like it never existed.
Welcome to the Radical Health Rebel podcast. I'm your host, Leigh Brandon. This work started for me several decades ago when I started to see the impact I could make on people, helping them to identify the root cause of their health problems that no doctor could figure out, including serious back, knee, shoulder and neck injuries, acne and eczema issues, severe gut health problems, even helping couples get pregnant after several IVF treatments had failed. And it really moves me to be able to help people in this way. And that is why I do what I do and why we have this show. In this week's edition of the Radical Health Rebel podcast, I spoke with Dr. Lonnie Herman about the system of assessing and treating chronic pain and disease and why his approach works so fast. We discussed the weaknesses of the current medical approach to chronic pain, the most common causes of chronic pain, finding the root cause of chronic pain, including how the novel experimental therapies can cause pain, and we discussed the common pain conditions that Dr. Herman sees in his practice. This is a real eye-opener of an episode and one you really don't want to miss. Dr. Lonnie Herman, welcome to the Radical Health Rebel podcast. Thanks for coming on the show.
Thank you so much. I really appreciate you having me on this morning with your friends and followers. Thank you so much.
Oh, it's my pleasure. I'm really looking forward to really getting stuck into what you've got to tell us today. So just to kick things off, could you share with the audience an overview of your journey, including, the many subjects that you've studied to get you where you are today, uncovering the root cause of and helping people overcome chronic pain and other diseases as well?
Yeah. Oh, so that's what it's all about, by the way. So starting off with that, I realized through my time of working with patients that it was all about delivering results, delivering real impressive results of helping people overcome chronic pain, of helping people either reduce the severity of the disease or completely eliminate the disease and let them get back to living a life with optimal quality health. So let me start out with that. When I was a child, I didn't really have a great, I'll say with my upbringing, it wasn't like, this is the direction you're going in life from early on. It was probably around 15 years old. My mother sat me down one night and she said, you got to pick something to do. You're graduating high school next year and you got to go off to college. And I was like, I don't know. We've never had this discussion before. And it was right around that time, my older brother hurt his back and he went to a chiropractor who helped him feel better. And we called that chiropractor a doctor. And it was interesting with my mother that same night, she said, you have three options: doctor, dentist, or lawyer. Pick one. And I said, but I have no interest in either one. So anyway, it was my brother and I were into bodybuilding, weightlifting, and exercise. And he hurt his back and it was terrible. He could barely walk. The pain was so severe. The chiropractor helped him get better. We called the chiropractor a doctor. And I just said, let's do this because it seems like it's not invasive. I didn't like the sight of blood or open wounds. And so I chose chiropractic just for that reason. And then when I got out of chiropractic school, which was a very philosophy-based school that I went to, that all the human body needed was the chiropractic adjustment and a clean lifestyle, and all the ailments disappear. So I believed it. I had no other instruction, had no other education in healthcare. And so I believed it until when I came out of school and I started working out in the real world, I realized that people with chronic migraines, the chiropractic treatment did not just relieve the chronic migraine. I realized that the depression wouldn't go away with chiropractic care. I realized that heart disease would not go away with chiropractic care. Some aches and pains for neck or arm or hand pain or leg pain or foot pain, it didn't just go away with chiropractic care. People with multiple sclerosis were not going to get up and walk again if they were paralyzed from MS. So I started to get very frustrated very rapidly after school because when I started working, because I wasn't seeing the impressive results that I thought I would really get to enjoy seeing with people coming into my clinic. And also, I noticed with chiropractic that there was a very small percentage of the population who was willing to even set foot in a chiropractor's clinic. So I just decided one day, you know what, it's time for me to get more education because I'm not going to live the rest of my life not delivering results, great results for people with chronic ailments. And I noticed people around me who I knew for many years of my life. One person had a heart attack, another person had cancer, another person had Parkinson's disease, another person had anxiety, another person had a rash problem. And I was like, well, what do I do for these people, basically? And so anyway, I decided to go back to school for postgraduate studies for several years. And I started with neurology, functional neurology, it's called. And then the school offered so many different courses, or let's just say other areas of study about the human body. And I decided to take everything, what's the word? Developmental disorders with children who turn into adults with autism or with ADD or so on. So I took that whole program, and I took the balance disorder or vestibular disease program, people with vertigo or dizziness problems. And it gave me great insight. I took the human brain dissection course that gave me some great insight into the human brain. Then there was there was courses in blood chemistry analysis and endocrinology and neurochemistry. With the neurochemistry, it was interesting. It was just a 3-day program that was offered through the school, but gave me greater insight into the functioning of the nervous system and possible links to disease. And that's where I was introduced to like gluten testing and food sensitivity testing, because there are people who had various, whether it was somebody had depression or somebody had pain, and there was more understanding about how diet can either help to, I'll say, influence a disease or worsen symptoms in the person, whether it's a rash or it's a GI problem or it's a pain problem. Which actually, going back to chiropractic school, it was very interesting, and we had to take a year of nutrition in there. And in that program, I became a vegetarian. I actually became a vegan. I did that for a year and a half, partially vegan. Let me say that was probably about 3 months. It was too restrictive for me.
Mm-hmm.
But with the vegetarian lifestyle, I didn't feel better. I actually felt worse. But I was I don't want to harm animals. That was the reason why I went in that direction.
Mm-hmm.
But the teacher back then, we're going back over 20 years ago, the teacher told us that there were certain pain, because we were so convinced in that school that chiropractic was the way to help alleviate a headache or so on. And this nutritionist told us there are some people who get headache relief just by taking a certain food out of their diet. Mm-hmm. And I heard it, but I didn't truly understand, nor did I implement it at the time, besides the vegetarian lifestyle for a while. But with vegetarian lifestyle, there was high gluten intake, and there was still other things that I realized later on that possibly weren't the best strategy. Anyway, so back then. So anyway, coming out of school, coming out of neurology and neurochemistry, I took a program in neurochemistry. I took a program in neuroimmunology. And then I took programs in alternative cancer. Let's just say not treating cancer, but treating the person to help the person get stronger, help the person to, if we can just say in simple terms, detox their body, to help them have a better chance of overcoming cancer. I looked at different clinics around the world who are doing this alternative type of cancer, let's say alternative human healing, to help the person overcome the cancer on their own. Down in Mexico and Switzerland, I looked at different clinic models, and I started to realize that, and one of the reasons why I started to realize was this, about how teeth are connected to disease, potentially, possibly like a root canal. You know, you and I discussed before coming on here that you had one that you had extracted. So you possibly have talked to your, listeners or so on about teeth before. I got really deep into working with dentists, of understanding how to test the teeth, how to be able to evaluate a person's jaw and see if there's anything in the teeth or in the jaw that is linked to disease of the brain or disease of the heart or any other part of the body for that matter. I'll tell you that, and really in the neuroimmunology program, the immunologist who taught us that's first when the leaky gut idea that I've ever heard of that. And this is probably about like 12 years ago or so, where he introduced to us how to test for the leaky gut. I think that was the first time that actually came on the market to order those labs. And It was very interesting, but I'll tell you what I realized when I started implementing all these strategies. I'm going to get to a little further down the road of what I do now. I haven't gotten there yet, but when I started implementing these strategies of providing certain supplements to people, the functional medicine type of model, I got into that. I was ordering a lot of laboratories, stool testing and food sensitivity testing and adrenal hormone testing, adrenal function testing, and antibody testing to see if there's an immune reaction against different tissues. And there was stomach infection testing, and there was neurochemistry, supposedly, if it was true, neurochemistry panels to see if somebody had a high or low serotonin or a low dopamine or so on. And I'm giving just an overview here because it was a decade of studies. I began to realize that there were certain causes of the disease that I wasn't able to uncover with these various laboratories or providing these various supplements. And when I actually called the immunologist one day to thank him for opening my eyes about what led to disease. Because what he showed us in that neuroimmunology program was that there were scientists from around the world in different laboratories around the world that were not funded by drug companies. So they were not to say, their goal wasn't to say that it was the medication that was going to alleviate the symptom of rheumatoid arthritis or of lupus or whatever the symptom, or a headache, whatever it was. What he pointed out to us with these different studies was that every single lab around the world who's doing research on rheumatoid arthritis or MS or diabetes or thyroid disease, it was chronic infections and toxic overload in the body that was causing the breakdown of the tissues or causing the autoimmune or causing the immune reaction against the body. There was a biochemist who was a mentor of mine for 3 years, and he really introduced to me the idea of epigenetics. And it was that the environment triggered the disease of the cell. Basically, it wasn't the DNA that programmed how the cell was going to, exist. It wasn't an Alzheimer's gene that produced the outcome that Alzheimer's was their definite, outcome in life. It wasn't a breast cancer gene that's going to make the person develop breast cancer. It's that, bottom line is, there are different environmental stressors that would lead to the disease of the cell, whether it's the 5G network or the cell phone or the X-rays or the emotions, right? Emotions play a role in causing disease of the cell. And that's proven even in just how the structure of water changes by love or hate or evil, talk or tranquility or peace. And so we can get into that if you want. But the reality is that the infections, the chemicals, the negative emotions, the electromagnetic field stresses, these all would trigger the disease process to develop in the body. And so I started to really think along those lines. And the biochemist, I was so into running the laboratories at the time. I was so into looking at what I believed to be more of a scientific type of analysis of the person, because I was trying to drift away from the chiropractic and the just natural way of doing things and look at it from a more scientific point of view, at least the way that I thought it was a scientific point of view that was more accepted by society of the, running laboratories. And here's where the answer is going to be revealed to us. But what the immunologist told us, back to the biochemist in a second, but what the immunologist had pointed out to us in one of the diagrams he showed us was that the mercury filling from an amalgam, silver filling tooth can drip from the tooth through a blood vessel into the thyroid. And now it's a mercury toxic thyroid to make, let's say, Hashimoto's or Graves' disease happen to the person. And I looked at that. I remember seeing that diagram and I was just like in just like utter amazement, like, wow. Well, I'm running hair heavy metal test analysis and I'm running urine heavy metal test analysis. But how is the hair or the urine going to tell me that there's mercury in the thyroid from a tooth? How could it even do that? So I called the immunologist up and I thanked him so much for sharing with me all these different, papers. And here's, I'm beginning to really see the light. And I said, but you put up this diagram about the mercury from the tooth and the person's thyroid. And I don't think I'm going to find that with a stool test or a leaky gut test or a gluten test. I'm not going to find that with a hair analysis of heavy metals for mercury or lead or arsenic. I'm not going to find it in a urine analysis. How do I know if the mercury is in the thyroid? That's what I have to treat in the person to help their thyroid recover. And he said, and he was 40 years in the immunology world. Okay. Pretty smart, well known in the field, very well documented. many peer-reviewed journals that he's part of. And he said, Dr. Herman, all the labs that you're running, they're not going to tell you if there's mercury in the thyroid. They're not going to tell you if the tooth is causing the disease in the thyroid. And I said, well, what do I do? He said, well, I don't have an answer for you. He said, but now at least you know the reality. Now you can go on your journey and try to figure it out. Yeah. So while I was so like excited to get on the call with him that day and happy that he took my call and that I could thank him, his answer left me, I got off that call with almost like a depression state. Like, well, what do I do now for a person? Yeah. How do I know? How do I find this out? So that really was the journey. That was the starting point of saying, like, I really have to figure this out which is where I am right now. I really have to figure this out for the person, because if that person has a mercury, from their tooth is on their mitral valve in their heart and it's causing part of their heart condition, or it's in their kidney, I can't find it with certain laboratories. So I found some research based in biophysics and quantum physics research, and through a cardiologist, a brilliant Russian scientist who I found some of this work through, where we can actually, which we'll get into a bit later, but we can actually literally again, back to the biochemist in a second, he started teaching me about muscle testing. So let me get into that. Okay. So he started teaching me about muscle testing, and I actually thought that was kind of a quack type of method of analysis. I was like, what do I need to learn that? What is that? These people with the arm gets weak or something. And until I was before the biochemist, until I was at a cancer class, a weekend. It was a 3-day cancer course that alternative healing cancer course. And it was done to me, and my weakness was revealed to me. And I was like, wait, do it again. And it happened again. And I was like, no, it's not possible. And then it was. And I said, wow. And that's when I then connected with the biochemist, who started teaching me about doing kinesiology. And once I really started to develop, and it took a few years to develop that skill, and when I pair that with this biophysics research, it just opened up doors for me to be able to now specifically diagnose if it's, let's say, the mercury is on the thyroid, or the Epstein-Barr virus is on the thyroid, or it's a candida fungus that's in the person's skin that's causing the skin rash, let's say, for example. So that's pretty much where we are. It's all about, again, I'm going to close this part of the discussion by what I said in the beginning. It's all about getting the most spectacular results for the person in the shortest period of time possible. It's not about just results, because results for some physicians, my viewpoint, for some physicians, they're okay with, if they're getting, let's say, 2 or 3 or so out of 10 patients better with their method, but 50, 60, 70% are not getting better. And they just say, well, that's just the way that it is. Mm-hmm. And it's not. It's only that way for them because they haven't expanded their mind or their skill set to be able to realize that there are other strategies that they could use, that they're willing to take the time to learn and adapt their skill set and expand their skill set to be able to deliver the most impressive results for a person. So that's pretty much it. Okay.
Yeah. So that leads me on nicely to my next question. So before we talk about the way that you work, can you share what you feel are perhaps the weaknesses of the current medical system when it comes to helping people with chronic pain?
Number one, I think that with chronic pain, I think that, let me say my point of view, in my humble opinion. Mm-hmm. Okay. So I don't know every single physician in the world, obviously. But for the people who I've had the opportunity to work with and work for, to help them get out of pain, of whether it's fibromyalgia pain, or it's pain from, they have MS, or they have lupus, or they have arthritis, or they have whatever the back pain, or they have headaches, or whatever the symptoms. I'm not minimizing their concern or their symptom. I'm just saying whichever symptom or series of symptoms and whatever diagnosis label has been given to them regarding those symptoms, whatever they're suffering from, for the people who I've had the opportunity to work with and for my opinion of some of the interviews that I've seen on YouTube and other places, that certain physicians of very big top neurologists or big top rheumatologists in hospitals or big universities, when they're giving their opinions and their supposed insight to the condition, the reality is they're missing the true causes of the disease. And so it was very interesting. When I didn't really get this. I was trying to, with chiropractic many years ago, work with people with fibromyalgia. And I said, I've got a nice office. I'm a nice guy. I do good chiropractic work. They should just respond and get better. And they weren't getting better. So maybe they had a good day here and there, but it wasn't because of what I was doing for them. And there was a video that I saw, I think it was called Under My Skin, where they talked about Lyme disease and how bugs got in the body and caused the disease, and when the person could recover by getting rid of the bugs, or decreasing the, let's say, amount of infection that was in the body, people had tremendous improvement and reduction in their pain and improvement in their health. And that video really helped me to start to see, like, there really is a way of helping a person get out of pain. And that's got to be the truth, things under the skin, basically. So I think that these physicians are not, I don't remember your exact question, but I believe it's this point, is that they're missing the causes. And there are people who can have high levels of heavy metals in their body, as well as they can be also living with, let's say, a chronic infection of, let's say, Epstein-Barr virus for however old they are. It could be 10, 20, 30, 40, 50 years of living with the virus in there. They can also have influenza virus and parainfluenza virus, and they can have mold and mold toxins and Lyme bugs and strep and staph and candida and other fungal infections and residues of antibiotics. And I can go on a long list of different pesticides and things that have gotten in, and even anesthesia chemicals from dental procedures that stay in brain and other parts of the body, and other anesthetics and sedatives that were used in other, possibly a surgery or a colonoscopy. These different chemicals and these organisms that get into the body, they stay there. And these different disease-causing agents, when they're there, they will continue to cause the breakdown of the body. And when a physician is looking at it, like, let's say a rheumatologist runs a blood panel on a patient and says, yep, you've got positive rheumatoid arthritis, and we see that you're not anemic, and your blood sugar is okay, so it's not diabetes, and your thyroid looks okay, and but you've got some high white blood cell count, and then they see, well, you do have an old Epstein-Barr virus, and you have an old, possibly old influenza, and but that's all that we can find. We don't see anymore, so they put them on a steroid, and they put them on an anti-inflammatory of some kind, or an immune suppressant, and that's it. Mm. And that's it. Or some of the doctors are going to say, go gluten-free or dairy-free, but even people that I realized when I was only doing that, or part of what I was doing years ago in the functional medicine arena, there were some people who did have a dramatic reduction in symptoms, but there were some people who experienced, so they told me they were doing it, right, living with a clean diet. They were not responding at all. So again, I believe that the thing that the physicians are missing about the chronic disease, whether it's chronic pain, is that they're missing how to find the truth in the person. They're missing how to find what it is. And when they don't do it, and they're running all these different laboratories, I'll tell you, there was a woman brought her daughter was 14 years old. She had terrible migraines every day. I don't remember how many years, but terrible migraines. She had chronic fatigue. She had brain fog. She had headaches also, because she arranged her head pain in two different ways. There was headaches and there were migraines. And when I looked at the blood laboratory that she had brought in from her records from another physician, I remember what rheumatologist or intern or general doctor, whoever ran the blood tests on her, I saw all this high Epstein-Barr virus count in the blood. And I said, she's got that. I'm only referencing Epstein-Barr only for this patient right now, but I'm just not saying that everybody has that as their truth. Okay, I'm just hypothetically bringing up certain points in people's, tissues that I'm studying to help get them better, but which it is pretty much a common infection, Epstein-Barr. But anyway, she had the doctor who saw her before me, to try to give her relief from her chronic fatigue and her head pain or migraines. He said that it was an old, dormant, inactive infection. And so when I did my exam with her, I found that Epstein-Barr was tremendous, infecting the brain. It was in the spinal fluid. It was in the meninges around the brain. And when she took the remedies that we created for her to get rid of Epstein-Barr and a few other things that I found in her, she came back for the next visit. All the migraines were gone. And she had those migraines for years. So they can I think that doctors are even partially misinterpreting what they're reading in a laboratory. Does that answer the question? I'm sorry, because I went off on tangent there. I don't remember exactly the simple form of the question that you asked, but
Yeah, it
I
does.
think they're just missing it.
It does answer the question. I guess if I was to summarize your answer, they're not really looking for the root cause.
Mm-hmm.
They're looking for a diagnosis that they can medicate.
Medicate and just have it where the insurance company possibly or the government approves of the treatment that they're going to provide, and they feel like they've done a good job, and they go home and they pat themselves on the back and they can, just say they're doing the work that they were trained to do, basically.
And the other
Not good enough.
thing I was going to add from what you said was they're not looking at the body as a holistic system. They're just looking at it in very individualistic parts rather than looking at the body as a whole.
Yeah.
Awesome. 42-year-old Chris came to see me whilst training for his first marathon. Initially, Chris wanted manual therapy on his calf muscles, which were taking a pounding from his long runs. I did recommend to Chris several times that he really needed a full exercise, nutrition and lifestyle program so he could complete the marathon in the quickest time and to minimize his likelihood of injury. However, 6 weeks from his first race, Chris suffered a debilitating back injury that meant he was unable to walk and was devastated that all his hard work had gone down the drain. Chris hobbled into my treatment room the next day to see if we could salvage the situation. I suggested to Chris that he do what I recommended all along, and if he did, he'd probably have a 50% chance of completing the marathon. So I've gave Chris a full physical assessment and then devised a comprehensive exercise, nutrition and lifestyle program. And full credit to Chris, he gave it 100%, totally dedicating himself to the program. Days before the race, Chris came to see me for a final tune-up and to ask whether I thought he was ready for the race. I suggested he start the race, but to stop if he felt any back pain, as there will always be other races. I received a text message from Chris the afternoon of the race to say that he completed it in 3 hours 42 minutes and he had no pain and had little to no muscle soreness. Chris has since gone on to run multiple marathons in impressive times. So if you're suffering from back pain that's preventing you from doing something that you love, why not arrange a consultation with me at www.bodycheck.co.uk so I can show you what's causing the problem and how you can get back to performing at your best. Now, back to the podcast. So do you have any view on the Eastern philosophy that suggests that pain serves a purpose or that the purpose is to inform us or teach us something? Do you have any views on that?
I don't know that point of view. I'll say that it is to teach us. There are two things. One is if somebody's got a chronic back pain or a chronic head pain or a chronic arm and hand pain, let's say, the body is giving us a sign that there's something that's invaded, whether it's a chemical and or an infection or multiple infections and chemicals that have gotten into parts of the brain or the body. And this is just a sign. It's like a check engine light that comes up on the car's dashboard that says something's wrong in the engine. It's a sign. It's a sign that something, sorry about that. It's a sign that something is in the system of the body, wherever it is, whether it's the lymphatic system or it's in the brain. It's something is there that we have to find and get rid of. So then the pain goes away. The pain is a signal. Now, could the pain be linked to a past trauma, whether it's a head trauma, like a brain injury, or is it from a past trauma of an emotional trauma? So that emotional trauma, what I figured out, and on my website, I have an emotional page all about this type of exam process I figured out to do for people to help people overcome depression, anxiety, as to serious symptoms that a lot of people deal with. But I've also realized that a pain in the body, let's just say somebody has high blood pressure, for example, or chest pain or shortness of breath, and it can be linked to a previous trauma that maybe the child was molested the adult was molested as a child, or a wife's husband was cheating on her, and then she found out and it caused devastating, real emotional stress. And that what epigenetics talks about is these different emotional traumas will trigger disease to be created in a disease state of the cell. And when we think of the human microbiome and the human virome, viruses and bacteria that are part of us and part of our genetic makeup, that these organisms that can be dormant, they can turn on and now begin to express themselves in a tissue in the heart, in the brain, in the thyroid, in the stomach, wherever in the body. And they now will make the person have that pain. So the pain sign is telling us something's wrong in an organ or something's wrong in some other part of the body. And it can be linked to an emotion because the emotional trauma triggered the cell's virus that's part of the cell. That virus is now activated. We have to find through the emotional situation and link it to that virus that's in, let's say, the heart. And when we can link that, the person was molested and it triggered this virus that's on the heart, and now they have high blood pressure. And when we link that emotion, when the type of test that I figured out to do to link that emotion, that time in life, that experience to the virus that's on the heart, get rid of the virus from the heart, now the blood pressure goes down and they've healed from that emotional trauma. So yes, emotional trauma. Yes, there could be a physical trauma, but yes, you are right, is that, let's say the liver is showing that, the shoulder hurts, for example, and it's an infection in the liver. So I believe that these just to recap what I said, is that the different symptoms are signs of something is in the body that we have to figure out what to do for the person to heal and get rid of that signal, get rid of that sign, get rid of that symptom.
Yeah, exactly. That's exactly how I see pain in the body. You've mentioned one example there, but in your view, what would you say are some of the most common causes of chronic or persistent pain?
Always there's infections, and whether it's viruses, multiple, usually at the same time, living in people's different parts of the body. There's bacteria that get into our body that exist, whether it's from an old strep throat and somebody took an antibiotic to get rid of the strep throat symptom, but the strep never really disappeared and it spread to the stomach, or it spread to the spinal cord, or it spread to a kidney, for example, and it's going to cause persistent pain for decades until it's found and eradicated from the spinal cord or the kidney and get rid of the pain. There's molds that get into the body and they destroy human tissue, and they will make people live in pain, suffering terribly with joint pain, with muscle pain, with head pain, with fatigue, with back pain, with bone pain. There's toxins that come from molds, mycotoxins. There are fungal infections and parasitic infections. And then again, there's many different toxins from the viewpoint of heavy metals that get into the body through drinking water, through vaccines, through possibly through just being born from a toxic. Unfortunately, humans are just innocent on the planet. A lot of humans are, not all, but there are, the mother might have been just a very nice, beautiful person who just absorbed pesticides and absorbed insecticide and absorbed weed killer spray and absorbed mercury and absorbed heavy metals and absorbed dental anesthesias and other chemicals and antibiotics. And now when she produces her newborn, the chemicals and any infection in her, for that matter, can just travel right through the umbilical cord into this new growing baby inside, and the baby's already born toxic. So it's infections of many kinds. It's toxins of many kinds. There's activated mast cells. And so those can be activated. I did I think a pretty good video on this. It's on my YouTube channel, Mast Cell Activation Syndrome, where these cells that are friendly to the body, they become activated and release certain inflammatory substances into tissues in the brain and the thyroid and the stomach and the heart and the blood vessels, anywhere in the kidneys. And they become activated because of emotional traumas, physical traumas, and through infections and other toxins that have entered the system. So there's that viewpoint. And then furthermore, there's other, like cytokines or other inflammatory parts of the immune system, which are triggered by these other infections and chemicals and traumas, emotionally and physical traumas, is that these different inflammatory substances, they exist in the blood, and they are, when the blood goes to the glands in the face, especially where the saliva is made, the saliva is going to be produced with whatever in the blood. The blood is, let's say it's carrying influenza virus, it's carrying mercury, it's carrying activated mast cells, it's carrying different types of cytokines, it's carrying herpes, it's carrying mold in the blood, it's carrying a bacteria. When the blood goes to the gland in the face, here in the cheeks and underneath the tongue, it's going to make the saliva with those different infections and chemicals. So when we look at it from the viewpoint of the saliva is also a toxic infected substance that we are swallowing. And just like when we swallow water to hydrate our body, the water goes to the skin, the water goes to the bones, the water goes to the brain and the spinal cord, the water goes to your spinal fluid, the water goes to your organs, your muscles, your glands, your blood vessels, your lymphatic system, every part of your body, your eyes, right? Every part of your body needs water to remain hydrated, to stay alive. When we swallow that water and the water eventually gets in the bloodstream and the blood carries that water over to different parts of the brain and the body, we are also swallowing saliva. So when the saliva is carrying different germs and chemicals and cytokines and activated mast cells and possibly negative emotions, I'll elaborate on that in a second. When the saliva is carried just where the water goes, which is every other part of your body, including your skin, your eyes, your brain, you're everywhere, the saliva is going to be, again, carrying all these different germs and toxins and inflammatory substances. And that saliva is going to be deposited into the same tissue where the water is to hydrate those tissues. So let's take it even to the point of view of what Dr. Emoto, Dr. Emoto with the water, with the emotion, right?
Yeah.
Love, hate, and all that evil in the water. Every single cell in the human body is made up of water. A large, let's call it 80%, 85%. Your saliva is deposited there as well. So remember, I'm going to keep harping on that because the saliva carries different germs and chemicals and infections deposited into, let's say, the thyroid. It's deposited into the frontal lobe of the brain. It's deposited into the amygdala, the fear, panic, anxiety part of the brain. It's deposited into your liver. It's deposited into your lymph. And so, and then the negative emotion, the imprint of people talking negatively to themselves. It's always my fault. It's always, I'm always doing the wrong thing, or I'm never going to make it in life, or I'm never going to be good at that, or I'm never going to get this, or why can't I reach my goal? And so when they're always the negative talk to themselves, and that's pretty common, negative talk imprints the negative into the water and the saliva as well, which is water based. Right. So when we're imprinting the negative emotion into that fluid, and that fluid is deposited into the bone, into the brain, into the thyroid, into your kidney, into your stomach, into your heart valves, that's another level of imprinting the negative energy into the tissue, causes disease in the body. So when we can, using the saliva, by the way, when we can find where that went in the brain and the body, when we can get rid of these negative emotions, get rid of all these things, the infections and chemicals, the whole disease. I mean, I've seen heart disease disappear. I've seen eczema for a lifetime of a person disappear. I've seen asthma disappear. I've seen headaches disappear. I've seen people with one woman, you could see on my YouTube channel, she had paralyzed legs for 5 years with multiple sclerosis, 33 lesions in her brain. She's able to move her legs again. I've seen people with incontinence, urinary bladder incontinence, stop with this work. Bladder pain, stop with this work. Fibromyalgia pain, stop with this work. And the list goes on. It's a thrill. So yeah, that's the sum of it.
Awesome. So just moving on from that, can you tell us about the testing that you perform to establish the root cause of someone's chronic pain? Yes.
I will say first, and thank you for that, for offering me this as well in this conversation. I'll say that it takes a long discussion, and I'm happy to describe. When I mean a long discussion, for any of your listeners, it can take me at least 30 minutes to describe how I'm doing what I'm doing. But I did create on my website, I created a free download of an ebook that we wrote to help give people some insight. It's a very quick read. It takes maybe an hour to read through this book in very common language. And on the very last page of my website, I put a video up on this, the last page of the book. There's a link to a video where I describe my journey as me as a physician, as well as it's about 20 minutes or so of description of how basic insight, how to do what I do, how I'm finding things in tissues. But I will tell you, so people can reference that if they like to get more insight, because again, my description is a bit long. Because there's so much to describe, I'll just say that for those who understand that every single infection, let's go with this way of looking at it. If you say that there's viruses that can infect the body and hurt people, there are different viruses. There's one called influenza. There's one called herpes. There's more than one herpes, but let's say herpes, there's influenza. They're different. They're viruses, but they're different. There's cytomegalovirus, there's poliovirus, right? There's measles virus, there's chickenpox, there's different viruses. And why are they named different, even though they're all viruses? It's just like we're humans, we're both men, but we're named different and we're not identical, but we still have two eyes and two arms and legs and so on. So we're very similar. We're not horses and we're not sharks and we're not cows, right? But we're very similar, but we're still unique to one another. And so viruses, what the scientists have discovered is that they are unique when they can look at them under a microscope and how they act. They're different. So they know that they can look at one and say, that's influenza. That's not Epstein-Barr. Oh, this one over here is herpes simplex, but that's not herpes zoster. Herpes zoster is a different type of virus, but they're both viruses. And there's cytomegalovirus and Coxsackie virus, right? So there's parainfluenza virus, there's Zika virus, there's COVID. So there's different viruses. So when they look at these viruses under a microscope, they can see that they act a bit differently and they look a little different, but they're still called viruses. They're not called bacteria. They're not E. coli bacteria. They're not staph bacteria. They're not strep bacteria. They're not gonorrhea or syphilis bacteria. Named all different. They're all bacteria, but they're named different. They're not candida or hookworm or, right, well, candida, let's go, but they're not histoplasma fungus. They're not different molds. They're not black mold. They're not called a hookworm or a pinworm or a tapeworm, right? So there's different parasites, there's different bacteria, there's different viruses, there's different molds and fungus. And what these scientists, these biophysicists, what they discovered is that they were able to measure the frequency of these different organisms. And so they know, and I'll try to make it in a simple way to understand what people are familiar with, like a radio. If somebody turns on, which younger listeners may not realize that we used to have an AM FM radio. We still do, but I'm kidding, because there's Pandora, there's Apple, right? There's YouTube. You can hear music in other places, but we have an AM radio dial and an FM radio dial. And when we get in the car and we turn on the radio, we have if we're on the FM system, we can turn it from 93.1 FM to 93.9 to 94.9 to 95.7, 100.7, 103.5, or whatever the radio stations are by you. But you understand that there's different frequencies, and those frequencies are radio waves. Those, without the radio, us with our human ears cannot hear the radio stations. We need the device called the radio, because without it, we don't hear. But all those radio waves are around us. We just can't pick it up with our own sense of hearing without the device that pulls in that information from the air around us. And we can hear, if we turn 103.5, we hear that music and that series of commercials and that DJ that's on that radio station. If we turn it down from 103.5 to 102.7, it's going to be different information, different music, different DJ, different commercials. And so what these scientists discovered, these biophysicists discovered, is that all of these different viruses, for example, they have different frequencies. So I'll make it simple. It's like an FM radio of 103.5. Let's just call that influenza. And parainfluenza is a 103.9. And Epstein-Barr virus is a 104.1. Right, basically, if that makes sense, the way I'm describing that, you get that? Yep. And so when we look at like strep bacteria, and there's different strains of strep, and there's different strains of staph, and there's different mycoplasma, and there's different Borrelias and different Bartonella bacteria. So understand that what these scientists were able to discover is that all these different organisms, they have their own frequencies, their own individual unique signature, energy signature. So I've obtained samples of these different organisms. I have them here in my clinic in separate vials of which organism. I also realized that these scientists, and that's in addition to viruses, that's the same for bacteria, what I'm saying, the same for parasites, the same for mold, the same for fungus. The same goes for heavy metals. I mean, if we were blindfolded and a physician, a scientist, or person, just you're blindfolded, and they take a 1 ounce brick of silver and put it in your left hand, and a 1 ounce brick of gold and put it in your right hand, and you're blindfolded, you won't know the difference. They're both shiny, hard metals. They're both an ounce. They both feel the same. They will both weigh the same. They're both an ounce. So when you take off your blindfold, as long as it wasn't tainted in a way, like it's just lead coated with silver paint or coated with gold paint, you're going to know that's gold and that's silver because you can see it. Underneath the microscope, or even according to chemistry analysis, scientists can tell that this is the energy of gold, this is the energy of lead, this is the energy of silver. You understand? Mm-hmm. So Frequencies also, each individual heavy metal has its own particular frequency, just like a radio, just like a virus as opposed to a fungus or so on. The same and that goes for any chemical, therefore, okay, any toxin. And the same goes for the organs, the body parts in our body. So the retina of the eye is the retina. It has its own frequency. The lens of the eye has its own frequency. They're two totally different tissues, and these biophysicists found they have their own frequencies, their own individual signature. The mitral valve on the heart is different than the tricuspid valve, different than the aortic valve. They have their own signature, so to speak. The stomach is different than the pancreas. Pancreas is different than the liver. The ovary is different than the adrenal. The prostate is different than the thyroid. Do you understand? Mm-hmm. So the same goes for every tissue in the body. Your lymph node is not your bone marrow. Okay. So I have samples of these different tissues of the body, and they're labeled for what they are. So whether it's the heart or it's the stomach or the thyroid or the parathyroid or the adrenal cortex or the frontal lobe of the brain or the amygdala of the brain or the skin or the fascia or the arteries, not the veins. I have all these different samples of these tissues. And so each tissue, each infection has its own particular energy. Now, we have a device that's made of metal. Keep those, that everything I just said, keep it on the side. Put that on the side for a moment, okay? So let me just go with this. Before I tell you about this device, many years ago when I was learning about muscle testing through that biochemist, he talked about different points using an Eastern form of analysis, a Chinese form of analysis of acupuncture points on the body. Mm-hmm. So I learned this whole system to go around the whole body, and I did this for probably about 3 years. This whole system of going around like to the stomach point, the liver point, the gallbladder. At least we thought it was the point for the liver or the gallbladder. I thought we were touching the thyroid or the stomach. Let's just say, for example, or the right kidney or the left kidney. And with that method of analysis, we were able to think we were getting the reading that the right kidney was weak, and it was because the person needed this particular supplement. It was this one that had whatever herbs in it was supposed to help like a parasite. It helped the body rid the parasite. So I was trying to diagnose as like there were parasites in the right kidney, for example, through that method. And person would take a supplement. Some people got better, some people didn't. And I didn't understand why, but the muscle test showed me what it was, but I didn't at that point truly understand what I was doing. I still had some really good results, but I had some that weren't so good results. So
Catherine had always been fit and active when she suffered a debilitating back injury. She was barely able to get out of bed or walk without being in excruciating pain. She visited her GP, who prescribed anti-inflammatories, painkillers, and muscle relaxants, and also referred her to an orthopedic consultant. Catherine was bedridden for 10 days and subsequently could only get through the day with large doses of the prescribed pills. Catherine was diagnosed with a prolapsed disc at L3-4, and she was offered anaesthetic injections or spinal surgery. She was horrified and concerned that she would have constant back problems for the rest of her life. Catherine was miserable, could hardly drive, a day at work was agony, and any movements in bed were very painful. I carried out detailed postural assessments, muscle strength tests, and analysis of her movement patterns. I identified the biomechanical problems and prescribed a very specific exercise program to correct her posture, reduce her level of pain, and to prevent the injury reoccurring. After 5 weeks on the program, the pain had reduced hugely in her back, and Catherine stopped taking painkillers. After 10 weeks, Catherine was back jogging and doing more intensive exercise with absolutely no back pain, and she was so pleased that she was able to pick up her young son again. If you're suffering like Catherine was, and you'd like to find out more about getting to the root cause of your back pain, go to www.bodycheck.co.uk and request a consultation. Now, back to the podcast.
Fast forward to now with these samples that I have, because what I started doing back then, I had gotten samples when I first learned that I can get samples of these different, let's say, Lyme disease infections and these different bacteria and parasites and so on, viruses, and heavy metals like mercury, lead, and so on. I was going to the organ and I was finding that the person was weak when we touched that organ. So I was saying that right kidney, for example, was weak. So there was a problem with it. And now as I started matching up to that organ, oh, well, there's Lyme disease in there. Okay, well, let's now try to match up the supplement that's going to get rid of the Lyme from that organ. I started getting even a little bit better results, but there was still something missing. And without getting into the dental discussion, because that's a whole nother big topic, but once I got these samples of these different parts of the body and the samples of the different infections and chemicals, including vaccines and many different things, and even the new ones that have just come out in the recent years, by the way, okay, without saying those words, I have those. So, and I've seen some, I'll tell you what I've seen about that. I just have to touch on this real quick. I've seen some devastating, in many people, devastating symptoms happen to them. And in some people, in just literally within a day of treatment, the symptoms just disappeared like they never existed. Wow. It's incredible. I can expand on that if you want. But back to this. So we have a device that's made from metal. It's made of aluminum that the person holds in their hand, kind of like a pen. It's like a tool in their hand. And it's got a copper wire, insulated copper wire that's plugged into the tool. And that wire is plugged into these metal aluminum plates, these trays that we can say plates or blocks of aluminum. So when the person is lying on the exam table and they're holding on to this metal tool in their hand, and it's not a machine, it's not a computer, there's no plug-in electrical device here. We don't want to get EMF in the body. We want to be able to remove it from the environment and remove it from the person's body. Without getting all into that, I can talk about this for a long time. There's so much to share, years of development of this. But we don't use machines at all because the machine can imprint, does input EMFs into the human body. And that can also cause a disguising of the true disease-causing agent that's in the organ. So when the machine prints out a chart that says, oh, they have, whatever XYZ infections and chemicals, and it could be totally wrong because the interference that's in the person by the EMFs that are in them, that's in the environment and getting into them from the machine, it can totally give a false reading. So I don't think that they're getting a higher percentage of the people better with these different bioresonance types of machines. Okay, so with that said, there's no machine here. But we have this device that's made of metal, aluminum and copper. And so what we do understand, all of us listening right now, and you and me speaking, we probably have had a dead battery in a car at one point in our life, and we can use a jump start cable, right? And connect that cable from a good battery to a dead battery. We did not have to go to school for physics or engineering to learn how to jump start a car. Somebody showed you, oh my God, I can start the car up again. I don't know. I was like 10, 12 or so years old when I saw that happen. I was like, wait, that battery, the car didn't work and now it does? Oh, that's cool. I didn't understand anymore. I just knew it started and we could drive away and get a new battery put in. But what we don't see when we're jump starting a car is we don't see the electricity running from battery A to battery B, right? We don't have a meter to measure it. We don't see sparks going off. And we did not have to go to school, engineering school or physics school or any other kind of school to learn how it works. We just buy that it works because we can drive away with the battery charge. The reason why I'm sharing this with you and your listeners is the energy travels through the cable. And we jumpstart the car and we know that it worked. With this work, we have when somebody's holding on to the same type of metal, aluminum and copper wire, the device that they're holding on to, and I take a sample of a poison that's in a sealed vial. When I put the poison on the tray next to the patient, and the energy goes through the glass vial, in through the metal tray, through the metal wire, into the metal tool that's in their hand. The energy just travels from what's in that vial through the metal into the metal tool in the person's hand, and the human body feels that energy, but the person's not telling me, ouch, that hurts me. So I'm going to measure a reflex. So if let me step back for a second. If a person was sitting in a doctor's office on an exam table, and the doctor takes out a reflex hammer and hits the person in the right knee with a knee jerk reflex, with that reflex hammer, and the person kicks their leg up high, right? And so we're measuring the stress reaction to that reflex hammer hitting when we hit the knee in that one point. Because the signal goes from the knee, up the thigh, up the spinal cord, into the brain. And instantly, within milliseconds, the brain sends a signal down through the nervous system, down to the muscles of the right thigh muscle, and it kicks out the shin. So instantly, hit in the knee, the signal from the knee goes up to the brain back down to the muscle, and it kicks out the leg. The person sees and feels that reflex. The doctor sees it, but doesn't feel it. But the person can see and feel that reflex. If I was to take out the reflex hammer and hit the person in the left knee, And let's say it's not as much of a reflex of the right knee. We could see there's less of the reflex, but we still see there's a reflex. So at least I'm able to, as a physician, say, well, the person sees and feels there's a change from the right to the left side, right? There was a good reflex on the right, not as good on the left. I see that there's not as good of a reflex on the left side than the right. The patient feels it, they see it, they get it, they understand because they're witnessing it. And so now I've got to find why the reflex is not normal. All right, so now let me put this example aside for a second. If I, as a physician, went up to a person's eyes and did an eye exam and I took out a light and I shined it in the right pupil, I can see the pupil reflex. The pupil gets constricted. Not that the pupil does. The pupil's a black hole. There's muscles like in the blue of the eye or the brown or the hazel or the green of the eye. There's muscle fibers in the iris. Those muscle fibers squeeze down. Why? Because the light enters the eye, like the reflex hammer in the knee. The light enters the eye, it stresses the retina of the eye, and it stresses the visual parts of the brain. And the brain sends a signal because the light's so bright. The brain wants to dim the light. It can't do it. It can't just say put sunglasses on. So what does the brain do? It sends a signal through a nerve that goes to the iris muscles, and they squeeze down and make the pupil smaller. That's how it can dim the light entering the eye and the brain. You understand? Mm-hmm. But the patient who's getting tested with that light reflex, pupil reflex analysis, the patient is not able to see the reflex, the pupil size change in their own eye. The patient can't feel it change in their own eye. The physician is able to see it and feel it, but the patient has no idea it's happening. They might know about a reflex in the eye, but they don't see it or feel it. Unlike the reflex in the knee jerk reflex, they see and feel that one. The pupil they don't see and they don't feel. I can watch both happen, okay, as the testing physician. So now let's go back to the person who's lying on the exam table. They're holding onto this metal device. I take a sample of a poison, sealed vial. I won't make them drink it. They're not going to swallow it. Right? That would hurt them. Maybe they have a seizure. Maybe they foam at the mouth. Maybe they poop in their pants or something from the, right? So, but we're not going to do that. Where they could notice that they had the stress reaction to the poison if we did that, but we're not going to do that. When I take the poison, I put it on the metal equipment, the energy of the poison travels through the metal tray, through the metal wire. It's felt by the person's energy in their body, like the pupil reflex. I can see the stress reaction develop in the body. The patient doesn't feel it or see it. When I take away that poison, the stress reflex leaves the body. The patient didn't see it or feel it. So I see that I can get a reading on them. Poison introduced them. They show me they're stressed by it. Take away the poison, the stress leaves. You follow me so far?
Yeah. So how do you see it?
So there's two ways. I could do it directly on the patient. If I wanted to get up and read their pupil, I could see the pupil size change. I could measure like one leg gets shorter than the other one. I use my wife as a surrogate in the testing. And this took more years because it was more accurate, because when I was doing the muscle testing before I found these samples that I'm talking about, I was realizing that the way that I could read on a person was using her as a surrogate tester. Where she's holding on to the person and I can measure her, because some people, they were too painful, don't touch them really, don't keep touching them, or they're too fatigued, they couldn't keep up with what I needed to do, or they're missing a limb. Right. And so it was just, it became, or they're shaking, they're tremoring, the arms are moving and they can't sit still because they have Parkinson's, let's just say. So it became, or somebody has like a POTS, I don't know if you know what that is, POTS condition. So they're just like short of breath. They can barely breathe. Their heart's palpitating. They feel dizzy. They can't sit up. They can't stay in one position for a while. It's too much for the person's body to handle for me to use them directly, me on them doing the test. So I had to figure out a way, because of the chronic ailments, the chronic type of disease that I see come in my clinic, that I love helping people get it better from, by the way, and we're very successful with it. I had to figure out what I was familiar with using my wife as a surrogate tester to now bring her into this method of testing. But we also had to find that there were interferences, there were blocks in the reading, EMF blocking the reading, what's on the patient's body, synthetic clothing materials blocking the person's reading, scars, tattoos, teeth of like a filling in a tooth or an implant. These things block the reading. And there's more than what I just said. But so we had to clear out these interferences so that A, the patient's body is going to reveal to me everything that's causing the problem. And B, she is not going to become an interference as a surrogate because she could block the reading. So that took a few years to figure that out. Now I figure it out. So So anyway, so I use her as a surrogate. So when she goes weak, it's because the patient is going weak.
Mm-hmm.
If she's not touching the patient, I could test her, but the patient's holding onto the equipment and I put the poison down, she doesn't get weak. It's just that when instant she touches them, she goes weak. You understand?
Mm-hmm.
You've seen something like
Yeah,
that,
yeah,
kind
yeah.
of. All right. So now let's go with when I take a sample of, let's say, the perfect human, let's say they have asthma or some kind of breathing problem. Okay. When I take a sample of the perfect human lung frequency and I put it on the equipment and the person becomes weak, stressed, that's telling me that there's something wrong in their lungs because they're within milliseconds of their body connected to the perfect lung. They're able to test their lung, compare their lung to the perfect lung, and the body will show me how much my lungs are hurting me. So when I move my hands like this means that they're neutral. And now when I connect the lung to the body becomes stressed. I see the reflex happen. So they're in a stressed state. The body's telling me something's wrong in the lungs. Now, when I reach over and I take a sample of, let's say, mold, and I put it down on the equipment next to the lung, if the body stays in that weakened state, stressed, it's not, I'm asking, is it mold that we have to get out of the lungs? So when I put the mold down, if it's not number one, it might be number two, but not number one, the body stays in the stress state to the lung. You understand?
Mm-hmm.
I put the mold away and I take, let's say, Epstein-Barr virus, and I put it down. The body stays stressed. It's not Epstein-Barr. I put it with the Epstein-Barr. I take a sample of, let's say, one of these new shots that starts with the letter M, okay? And I put that one down next to the lung and the body comes out of stress. The body just told me, get that shot with the letter M. That starts, get that out of the lung. It's instant diagnosis. It's just incredible. So now we make up these remedies. That's water imprinted with the frequency of the perfect lung and of the shot with the letter M that starts off that name of that chemical in the lung. And when they take the remedy of those frequencies, like cures like, the body will use that to get rid of that thing from the lung. But we can take it even deeper than this, because I realize that way of looking at it, it's still the right way. It's just that in the human body, removing all the interferences of the materials touching their skin that's not natural to the body. It's got to be organic cotton only, to a tattoo or a scar or a filling in a tooth or a pacemaker or a hip replacement or hair extensions or jewelry or contact lenses. So there's many different things that will interfere in the reading. And so there's steps to prepare the body to remove these interferences, okay? And the EMFs in the environment, the EMFs that are in their body, they have to be taken care of as well before I can get the right reading. But I also realized through I'll tell you, I'm always, when I'm working with a patient, I want to get them better, and I have to get them better as fast as possible for two reasons. Number one, because they deserve it. It's not like I'm working with some evil tyrant dictator who's killing people, okay? So people, they're just innocently going through life. For most, I'm not saying that somebody's a drug addict or not. People are innocently going through life, and they're just deserve to get out of pain and stop the suffering in their life. So I want to deliver it fast for them, because watching people suffer is painful for me, and them as of course as well. But also people, this is such a different way of looking at it and a different way of treating themselves that for some people, not everyone, but for some people, no matter how much education I give them, it's like if they don't start to see results in the shortest period of time possible in one treatment, then they may just say, well, this is not for me, and they give up. And so I had to, I didn't have to, I chose to just continuously observe the person who I did get the chance to work with the first, second, third, fourth time, and keep wondering, what do I got to do that's even better? How can I improve my skill set? How can I improve the service I'm providing a person to get them better faster? Because for me, my goal that I love my video testimonials that I can show the world, because one of the convincing, I'll just say one of the obstacles that people have is they need social proof that something worked. So in order for me to obtain the social proof, these video testimonials, and even in testimonials with some medical research to back up what the person is saying, or pictures before and after, a video before and after, the person not walking, or the person with the rash is gone, or the person with the POTS condition, now they're better, the neuropathy, the nerve pain is gone. So when people can actually see the before and after and hear from the patient, as well as possibly seeing medical reports of cysts in the breast disappearing, and I show the reports, or it's Hashimoto's disease is no longer shown on the thyroid, for example. When I can show that to the world, people their objections kind of fade away, right? And they just say, well, how was Dr. Herman going to do it for me? Because nobody else did. But I see that he's done it for other people. I'm willing to give this a chance. So the more of the proof that I can show the world that I can help people overcome these chronic diseases, help them overcome their chronic disease. That's a better way to state it. The easier it is for us to now help more people. Okay. So the more social proof, the better. Now, with that said, my goal is to get as many of these video testimonials as possible, because the sooner I can get them, the more proof I have, the easier it is to handle an objection in the next, the next discussion with the person, my assistant, who's helping people schedule patients here. So with that said, I'm always under, I've put myself in a position to do the best that I can to get the person better as fast as possible. Because even if the person's a believer in my work, their husband may not be, the wife may not be, the father or the mother may not be, or the other family friend who's, like a nurse or a doctor, they're going to, oh, this guy's just what a bull. Don't waste your time or money there. So I feel the extreme necessity to deliver the results in the shortest period of time possible. So with that said, I kept paying attention, and I mean, this is my life, a day, night, weekends. This is what I focus on. All right. Besides my wife, okay. Besides my doggies, and besides doing other things to take care of myself with hobbies to relieve that stress, I've got to get people better fast. So I discovered that there are certain functions that people have that can reveal to me that where the diseased organ is and which infection or so is in that diseased organ. So it's not as simple as what I just said before, put the lung down for the asthma and then it shows me and I know when they take the remedy and it's all gone. It can, but it's not the higher percentage of what's wrong. So I figured out when it comes to my emotional workup, there's a whole series of steps that I go through with that, where I have people repeating certain statements. So let's just say I can tell if they're telling me true or false, by the way, with the muscle testing. Mm-hmm. And so when they say, let's just say, and my name is John, they repeat my name, if that's truly their name, of course, my name is John, then it's true. There's no stress. If I had the person say to me, my name is James, and their name is John, and I saw the driver's license says John, but they say, my name is James, the body goes weak because they're telling me a lie, basically. If they say, I'm happy, when I know that in their paperwork, I'm depressed, I'm anxious, I'm hopeless in life, right? I know that's what's going on, and I have them make the statement, I'm happy, that's a lie. So we see the body gets weak with that statement. And then I can find that there's a infection somewhere in the body, and so when they take that remedy to get rid of that infection, that's tied to them not being happy, because the infection is the driver of making them not happy, is the point that I'm getting at, which I'll expand on that too, if you allow me, is that when they take that remedy, they get rid of that infection that caused them not to be happy, now they're happy, basically. It's more than that. I'm just giving a brief insight to this. So what do I mean by more than that? There might be 10 different infections, and it might not just being happy. There's other statements I have to make that I figured out to get such a deep insight into their past and their present, and what they think about their future also, by the way. Okay. So emotions are driven by infections and chemicals are in the central nervous system and in organs. And so when we get rid of those, the emotions clear up, and then now they're happy, and the depression is gone, the insomnia is gone, and the anxiety is gone, and so on. And even sometimes the pain, or like a congestive heart failure. We had a woman, 14 years on blood pressure meds for congestive heart failure, and in 2 treatments, the doctors told her that her ejection fraction of blood from the heart finally normal, because she already had the heart surgery for it. It didn't fix it. She took stem cells. It didn't fix it. She comes to me twice, and its ejection fraction is normal. The AFib disappeared, and the doctor says you don't have congestive heart failure anymore. Pretty amazing. So, and that was most of what I found with her that caused it was like 16 years ago, her mother died. And the mother died, and while the mother was living with heart disease, with diabetes and cancer, this now adult woman who was younger years ago before the congestive heart failure, this woman was trying to teach her mother, you've got to do this, do that, try to get yourself healthier, and let's, follow the right diet. And the mother wouldn't listen. So she harbored innocently, but she harbored regret and resentment. I loved her mother. She's not a bad person at all, this woman, beautiful person, but she harbored certain negative issues against that time in her life. That's what started the congestive heart failure, because it triggered these infections on the heart that made her have this cardiovascular issue. Yeah, you kind of understand?
Okay.
So I can go deeper into that, but I'll tell you that with any kind of condition, whether it's somebody goes from sitting to standing and they get dizzy or their heart rate goes up, I'm able to use that as an action in my exam. If somebody has a breathing problem, I'm able to use certain breathing steps in my exam. If somebody has a food sensitivity, I can find exactly why they have that food sensitivity, why they have that allergy to the food. So when I can literally have them taste a sample of that food. And we'll get into how I do it, but they taste a sample of the food and I find the body became stressed or weak by the food. And now I find that, oh, it's a liver with a parasite, basically. And the same thing goes for other chemicals in the environment. And so in my environmental stress exam, I've discovered that people are stressed by smelling bleach. Everybody has probably smelled bleach at some point, even if they don't clean with that, or the mother never did, or their parents never did, or whatever. But they've been to a restaurant or a school, or they went to a friend's house where it was. So that's more chemical pollution, that epigenetics that changes the cell function, changes the cell state of health or ill health now, to different other cleaning chemicals, as well as perfumes, as well as even certain things that people drink and consume that have certain aromas or fragrances, that these different items from the environment are also, through that sense of smell, are triggering disease state in the body by fueling if they were at once dormant infections, these different, or whether they were not dormant, it doesn't really matter at this point, but let's just say that it was a dormant infection, and the chemical pollution through the fragrances actually stimulates the dormant bug, for example, to turn on. And now, oh, my feet always hurt. Well, they didn't realize, and their neurologist who ran a nerve conduction test or an MRI or an X-ray, and maybe even they went to a functional medicine practitioner, or they went to a rheumatologist, or they went to an internist, or they went to 3 different neurologists, and they went to a functional neurologist, and they did all these things, but the feet still hurt, and they're not diabetic, and they had all the blood tests, everything looks normal. But it was because they were stimulated when they, smelled a certain cleaning chemical, and it triggered whatever it was that we find that's, mold in the brain, for example. Get rid of it, and then the foot pain goes away.
Are you a personal trainer, exercise professional, or medical professional who wants to upskill and take your knowledge to the next level? And would you like to take a class and be taught personally by me? I'm, of course, talking about Czech Integrative Movement Science Level 1 in Lancashire, England, on the 25th to the 29th of October 2023. I'll be teaching a clinically tested system that makes sense of the entire health and fitness journey, from anatomy to assessment to program design and coaching. You will learn 40 assessments, 60 conditioning exercises, and 27 program design principles. And the Czech framework brings them all together into an incredibly adaptable and effective system. From assessments to exercises to program design and coaching, this is a complete system. Students who master that system can create powerful programs that are tailored specifically to their individual clients' needs, abilities, and motivations. If you're serious about your work and want to take it to the next level, you can enroll on Czech Integrative Movement Science Level 1 with me in Lancashire in the north of England on the 25th to the 29th of October 2023. And you'll need to enroll by the end of June to complete the 3 fantastic prerequisite online classes: program design, scientific core conditioning, and scientific back training, that will prepare you greatly for your IMS1 class. For more details, check out the link in the show notes, but don't delay, places are limited. I hope to see you there.
So I realize, and that's only just a couple of examples. I've developed so many over the past 10 years of doing this particular work. I developed so many different exam steps that are not all necessary. In some cases, they're not all necessary, depending on the person and the complexity of their disease and the number of symptoms they have. But in a good number of people, I've got to go through all of these different, I've only mentioned a few right now, but all these different exam skills that I created, exam methods or strategies I created to find why is that person right. I don't want anything hidden from me. I've got to find it. The sooner I find it, the sooner they get better. The better for them, the better for me, the better for everybody, because now I get show more proof and help another person. So when we're able to find these different environmental stresses, as well as physical functions, as well as possibly the emotions, are triggering these different disease state in the person, and we can erase those different bugs, let's just say, or toxins that were in the tissues that triggered the disease state linked to that environmental stress or that emotion, the disease just like disappears. I'll tell you really, if I could give you one more example right now. My wife doing the work with me, because the work that we do, we're picking up energies from people all the time. And what happened with her after these, if I use the word jabs, you might know what I'm talking about, in the past, few years. So before we actually got the samples of them, it was like 3 months of her feeling like she's losing the function in her hand, literally. And she's in good shape. She's active. She's 40. I don't know. I won't say the exact number, but she's young. All right. So, but she went from feeling good to all of a sudden her hand's getting weaker. Her hand feels like it's losing sensation. Her arm is in pain. Her neck is in pain. She's up at night. She's holding her hand like, what's going on? I feel like can't open a jar. She couldn't do certain things with the hand. And she's getting really worried. We tried different treatments with what we do, and it wasn't working. And then I got those samples of those shots. And I found that it was the Moderna. Actually, there I said it. Maybe we bleeped that out, but the M was in her lymph. And she took that remedy, and in 1 hour, the 3 months of the problem with the hand disappeared like it never existed. Just disappeared. The arm pain went away, the weakness in the hand, the feeling of loss of sensation in the hand just disappeared like it never existed. And I didn't have to do my other forms of testing, because I through one way of finding, I found that, and it was like it was mind blowing of how fast that went away. And that's another way. Let me just say this for anybody who's listening to this. That's another very serious thing that we're up against right now. It doesn't have to be as serious, because there's an effective way of helping the body overcome it if they're doing this work. But what's very serious is that people who never even took it are getting it through what's called shedding. It is leaving one body to another. So the person who did get it can transfer it without them knowing. It's not that the person is doing it on purpose. Of course not. It's the science behind that chemical that was put into them that can transfer from person A to person B, and person B is now carrying it, who never even knew. And they're carrying it. And now they start developing, rapid heart rate, or their knee hurts incredibly and they can barely stand because what is it? And they go to a doctor, and the doctor looks at the knee and, no, we don't find anything wrong here. Just take your ibuprofen or take a whatever kind of pill to try to reduce that pain. But then I find that it was that chemical that entered their kidney, because the body's trying to detox it, and it happened through shedding. And when we get it out of the kidney, all the knee pain just disappears like it never even existed there. So that's something else that people need to know, that there is a way to handle that subject. And that one of the more devastating things that's happening in today's world is from that. Not just that, but that's a big part of it. And what really I wish that I could just come right and say it. It's troubling, because there's too many people. There's too many people who are injured from it. Yeah, who don't even know. So. Yeah. So hopefully that gives some insight of how I'm doing it. Yeah. What I didn't say, I'm sorry, is with the remedy. What these biophysicists discovered, and I talk about it briefly in the ebook that people can download their free copy on my website. What these biophysicists in Europe discovered back in the 90s is that we can take, just like Emoto talks about emotion in the water, we can, with our machines, we can actually transfer the frequency of, let's say, the strep bacteria that's causing the strep throat symptoms. We can transfer the frequency of that strep organism through the wire like a jumper cable, battery to battery. We could transfer it from the strep to the water. So the water becomes the frequency of the strep. When they take one drop of the strep, the body will just get rid of that infection that's in the throat, like cures, like homeopathy says. Yeah, so they take in the sore throat just disappears. It's gone, basically. Yeah. Does that make sense how I described that just now?
Absolutely, yeah. No, it makes complete sense. One of the things I want to take you back to, actually, you mentioned the lungs. Now, someone I know died a few years ago of pulmonary fibrosis. And I actually know someone else that's got it as well at the moment. Now, our modern medicine says, sorry, there's nothing we can do. You'll probably be dead within 5 years. Have you ever worked with anyone with pulmonary fibrosis?
I've never had that yet. I have, well, let me say this. There's one I'm trying to think who it is. I've never had long enough of a commitment with a person with that condition yet. Why do I say long enough commitment? I believe that pulmonary fibrosis is caused by chronic hidden infections in the respiratory tissues, possibly in the veins of the lungs, the arteries in the lungs, the bronchioles of the lungs, and the lung organ itself, and maybe coming from the liver, the lymph. I believe that, as you said earlier, the whole body is the sum of all of its parts, basically. So can one organ reflex to another organ and make that other organ disease? The answer is yes. So I've yet to have a long enough commitment from a patient and it's not a commitment. It's not commitment to me. It's commitment to them. It's just that it might take us more time to unravel that whole condition, to see the fibrosis disappear, is my point. I've helped people with different, so the answer is no, I haven't seen the end of it. All right. I hope I get the opportunity to help a person totally recover from that, because I believe that it can be completely recovered. But I have seen people with terrible respiratory condition, terrible. They've had asthma their whole lifetime. They have shortness of breath, but the doctors can't even figure out why it's not asthma. We've seen emphysema symptoms. We've seen all these. We've just seen it disappear with this work. But pulmonary fibrosis, I am looking forward to the opportunity to help somebody really recover from that.
Yeah. My next question is, what are some of the most common chronic pain conditions that you have tended to help people with?
So neuropathy, nerve pains that somebody has in their hands and their feet, right? They could have anywhere. So that's one. Leg pain, whether it's one or both legs, one or both arms. Back pain is very common. Head pains are very common. Chest pains are very common that we see. Stomach pains. I mean, there's pains anywhere in the body. We've seen, and we've had incredible success. Bladder pain, interstitial cystitis. We've had great success in helping people relieve that terrible chronic condition. I've even had people complain that they feel joint pains, arthritic pains, as well as bone pain. So it's anywhere. It's anywhere in the human body we've seen, and we've had great success with helping people alleviate those pain symptoms. And the causes are always the same thing. I'm not saying one person can have, it's COVID in one, while it's a MMR vaccine or a tetanus vaccine that was in the person's brain that made the body hurt. It can be that. Right. It doesn't have to be that they were infected with Epstein-Barr virus in the brain to make their body hurt. It could be from an old shot that they got that's in the brain, and so on. But those are pretty common. So I see pain all around the body. I see from joint pain. I see muscle pain. I see skin. It's just sensitive to the touch. Pain, to plantar fasciitis. Foot spastic pain in the feet. Carpal tunnel syndrome in the hand. Supposed diagnosis: carpal tunnel. Head pain. Even scalp pain, where it's not a migraine, it just feels like the scalp is burning. People have talked to me about what that disappeared with this work. So it can be anywhere in the body. And we've had success with all of those pains.
Awesome. So I know this isn't something that you actually do within your work, but what do you think about modalities such as exercise, nutrition, good lifestyle, deep tissue therapy, things like that?
Yeah, I think me personally, I love exercise. I'm in the gym 4 days a week. I do Krav Maga, which is an Israeli form of martial arts training. I do that. I try to get 4 days a week. I did martial arts for years. I did mountain biking. I love exercise. I think it's important for a stress reliever, but also just physical fitness. It's important. Somebody who's in chronic pain, like fibromyalgia, let's say, or a Parkinson's, they just can't do. They can try. But how good can they function really? And sometimes the activity, the exercise can actually make the person feel worse, is what I found. I think that deep tissue massage. Let me give you an example. Let's say somebody has a spasm that's around their hip muscle, down their thigh, and their butt, and into the foot, and so on. And they go for a deep tissue massage, and they can, let's say, feel relief that day, but the next day they're even worse. And so the massage therapist says, just wait another couple of days, put some ice on it, put some heat on it, just try to get some rest, because that's just common. We release some toxins, or so the body's draining, or the body, whatever is doing, and it really beat up the muscle. But that pain that they went for, that they felt relief for from the massage for, let's say, a day or a few hours, and then it just comes back like it never left. And the therapist is saying, well, just that's kind of what we expect. But now days go by and it still never goes away. And a week or two goes by and it still never goes away because it was the wrong method for the person. So let's just say, for example, that, if somebody's pretty healthy and they're not in pain, they're not in the chronic pain, the subject that you talked with me about the whole time here, they're just healthy, fine, get a massage. I mean, it's like, what harm is it going to do? Because massage does play a role, deep tissue therapy. It's going to play a role in helping the body detox and move things around and hopefully get things out of the body. It's powerful. It's just when, let's just say that a person went to get a tooth pulled, and the dentist injected the chemical into their mouth. And that chemical, 3, 4, 5 hours later, after the numbness wears off, that chemical moved from the mouth up to a part of the brain that controls the person's back muscles and leg muscles. And now the person goes for a massage where the back is really stiff and sore and the leg hurts. And so they get a deep tissue for an hour, hour and a half, or 30 minutes, 60, 90 minutes, or 120 minutes. They get some deep work. They get some physical therapy, stretching the muscle and so on. And the muscle just never gives. The muscle won't ever give in because the chemical from the dental work is in the part of the brain that controls those muscles. So when we can simply get that chemical out of the brain that I find that there, get the chemical out of the brain, all that muscle spasm just disappears like it never was even there within hours or a day or so. It's just gone without any other physical work to it. So I think for a person who's in good shape, deep tissue, fine. But another person who's got some chronic ailment, it may not be as good for that person to get that done at first because it can actually aggravate the system because the body, I believe that the body, whether it's the kidney is infected or toxic, or the brain is infected and toxic, that or the lymph or whatever part of the body is causing, let's say there's neck and shoulder pain or arm pain, for example. I believe that until you can find the trigger and rid the trigger. So there's the dental anesthetic got into the brain. It made the shoulder hurt. Okay, get rid of the dental anesthetic on the brain and it'll stop the shoulder pain. But going through and stretching and rubbing out the muscle can send the signals from that shoulder up through the nerve up to the brain. And the brain is like, I'm not letting go of that. I'm not letting go. It's the poison that's in me that's causing me to guard that arm. I'm giving you what you brought up earlier in discussion was, I forgot how you said it, but, what do you believe the symptoms are? Are they a sign of something, right? So that's how I see it. It's a sign of something. There's some trigger that we have to find. So that's the point. I forgot what the other part of the question was. Nutrition. Yeah. So nutrition. Yes. I think that nutrition is great. My wife, she makes juices, organic green veggie juices on a regular basis. We believe that we're getting good nutrition that way. I buy only organic food for the house. I don't always only eat organic food because I might go to a restaurant and it's just kind of monotonous, only cooking at home. So we do our cleanup the best that we can with what we're doing for ourselves here with our work. But nutrition is extremely important. People eating McDonald's, or they stopped eating McDonald's years ago, but the chemicals from McDonald's cheeseburger are still in their brain, by the way, or the gut, and we have to find that and clean that out, which we do. But when people are eating just fried foods and people are eating, poor, not poor quality. I mean, you're eating foods that have, let's say they're meat eaters and they're having, and I'm not saying to be vegetarian or not, that's not my point, but when the food has antibiotic chemicals in it, when the food has growth hormone in it, when the food can have illness in the food and people are eating those chemicals, that's getting in the body. I think that eating foods on a regular basis that are not organic with pesticides and weed killer stuff, it kills the body. It's hurting the person. So I think that nutrition is really, really important. With my testing, when I told you about a food causing a reaction, I did mention it briefly before because I do have a whole page on my website about my food sensitivity testing. And so we do design I don't design a diet of saying here's the recipes, but I do give people through my testing system a list of foods that they have to avoid and foods that are approved. Okay. And some people, they can only have egg whites. They can't have any beef, or they can't have any pork. They can't have any chicken. They can't have any turkey. They can't have any whatever. And some people, fish is fine, but meats are not fine for a little while. But when we find the foods that they have to avoid in order for them to get better faster, then when we retest them, that food that they had to avoid, they may not have to avoid it anymore because we got rid of the cause of the sensitivity to the food that made the symptom of the stomach pain or the throwing up or the headache or the fatigue or the whatever symptom. So no, food is a big part of this. Definitely. It's just, obviously don't eat garbage. Don't, eat candy bars and crap and think that you can be healthy because It's just never going to work. It just doesn't work that way. So good food is really important. Yet some people don't realize that they can be sensitive to even an organic tomato or celery juice. They can be sensitive. They can be sensitive to garlic. They can be sensitive to black pepper. They can be sensitive to vinegar. And they think that the apple cider vinegar is really good because it's supposed to clean up whatever people say about it, of like a candida cleanser or something. But it can actually hurt them, and they don't realize that it's fueling organisms in the body. So diet is extremely important, and we just have to make sure that the person is doing the right thing, because they can follow an autoimmune disease diet protocol that's common online, or an oxalate-free food diet, or they go as a paleo only, or they go as a vegetarian, or they go as a vegan, or they're going to do whichever style they think is right for them. But that person doesn't realize, because it's not like they eat peanuts and they break out in hives, or they eat chocolate and they break out in hives. A person can have a delayed onset from a food. And some people even have taken out, what I discovered with my work is that people can, and I've got one particular example. There's a video of, you don't see his face and you don't hear him talking. He wants to remain private. But he had lupus and he had a terrible rash on his skin. It looked like a bug eating through the skin, no exaggeration. And I showed the before and after with his skin pictures. The skin was terribly rashed, and then it wasn't after treatment with me. And I found he told me when I met with him that he stayed away from dairy. I think it was for like 8 or 9 months, because dairy is supposed to be part of the whole lupus, autoimmune disease. So he had dairy-free, no cheese, no milk, no cream, no yogurt, no nothing, right? So from a dairy point. And so when I tested him, I found that he still was having the reaction from the dairy, even though he was dairy-free for many months. So he told me he was dairy-free for many months. The reaction to the dairy, it was fueling the bacteria that was in the skin. So even though he had not eaten it, you are in 8 or whatever months, you are what you eat. So when that food is absorbed into the tissues to build the body and repair the body, that food is still, even if you don't touch, let's say, dairy-free for a year, let's say, or 3 months, the dairy that you consumed is still in you to build your bones and your muscles. And so when that dairy is still part of you, it's still fueling the organism that it was fueling that made the symptom happen. You understand? Mm-hmm. So there are some people, I realized years ago in the functional medicine treatment, that kind of line of reasoning I was following back then, why did some people get better when they went, dairy or gluten-free? And why did some people not get better dairy or gluten-free? And so I realized years later is that the organism that was fueled in the body, the organism that was fueled by, let's say, the dairy, like I just said about him with the skin rash, even though you're away from that food for months or years, that food is still part of you, and it's still fueling the germ that made you, the bug that made you hurt. So when we can find the connection to that certain food and get rid of the bug that was connected to the food, get rid of the bug, the symptom goes away. And most likely, in a very short period of time, you can go back and eat that food again and not have the same reaction. So the diet should remain clean, right? We want organic foods. We want healthy foods. But the person, in my viewpoint, from what I've seen, helping people truly, totally recover from these, let's call them food allergies or sensitivities, when they stay away from the food for a little while, we find what the infection was in the body. And I'll give you one example and another example in just a moment. But when they can get rid of the cause, they can eat that food again, and there's no more problem with the food. We had one patient, and I've got like 2 or 3 videos of this woman. I think she was about 18 at that point. She had Ehlers-Danlos syndrome, a joint disconnection, supposedly genetic disorder. Multiple joints would just dislocate. She had POTS. She had, I don't remember all the symptoms right now. It's a few years ago, but she also had chronic vomiting. She was vomiting multiple times a day and night. Even drinking water made her vomit, even drinking water. And so one of the other symptoms was that she could not, and it was like 5 years already at the point when I met her, she could not she could not eat corn, organic even, she couldn't eat corn, but she also could not smell popcorn. If she smelled the popcorn, even walking by in the distance, she walked into a movie theater and she tried to avoid where the popcorn stand was. Even just smelling the popcorn in the distance made her throat tense up. She had to use an EpiPen to be able to breathe again. She could faint, and so she couldn't even pump gas at the gas station because ethanol, corn product in the gas. She'd faint at the gas station. People used to have to fill up the car for her. She couldn't even go near the gas station. They'd fill up her car for her and bring the car back home, and then she could drive the car. And so now she has no more joint dislocations. I'll tell you one part of it, but no more joint dislocations. She just had a baby. She has no more POTS condition. She has no more vomiting. She's fine from this work. And what I found with her was that even though she avoided corn for 5 years, smelling it and eating it, when I was able to, with my method of testing, when I was able to stimulate her with the corn, I found that there was multiple different mold infections, parasitic infections, viral infections in her stomach. So once we got rid of those, the vomiting problem, she was not, understand, whenever she smelled popcorn, her throat would, would close up and she would faint. So the vomiting was going on even though she wasn't eating the corn for 5 years, right? Vomiting multiple times a day and night, even though she didn't eat corn in 5 years. So she avoided corn completely 5 years. When I tested her, the corn was still, even though she stayed away from it for 5 years, the corn was still causing her the problem. And it was because it was linked to these infections that were in the stomach. We got rid of those infections from the stomach and all the vomiting stopped and all the throat closing and the whole thing just stopped. Her EDS is gone, her POTS is gone, her everything. Those symptoms just disappeared from the treatments that we did. But so diet's really important, but even some people eating what they think is a healthy diet for them may not rid the symptom is my point of view. So yeah.
Awesome. Wow, this has been an amazing and very interesting conversation. But what's next for you?
For me, I plan on moving closer to where you are by Europe. I want to go to, there's a beautiful island near Portugal, where it's part of Portugal. It's called Madeira Island. So that's probably about a year from now. And work from there. Just the place is just gorgeous, beautiful, and seems peaceful. So while my time is still on the planet, I want to do the healing from there. So that's on the horizon for us. And just for me, just how many more people I can help to heal from whatever chronic condition that they have. And that's it. And just keep taking care of me and my family.
Awesome. And where can people find you online?
They can go to thank you for that offer as well, to share this with your followers. My website, I'll spell it out and I'll say it. It's www.drlonnieherman.com. That's DRLONNIEHERMAN.com, drlonnieherman.com. And so when they go on my website, it's a very big website. There's a lot of information, a lot of good, useful information. And there's a free book that they can download and take them more through understanding. And we'll showcase this podcast that you did with me. We're going to put this up on the website too, and people can hear, from our side again, this information. But that's it. So on my website, my YouTube channel is linked to the website. My YouTube channel, they can just find my name, drlonnieherman.com, as well as Facebook and Instagram. I've got that as well.
Awesome. And I'll put all the links in the show notes as well.
Thank you very much for that. I appreciate it.
Dr. Herman, thank you so much for coming on the show and, sharing your knowledge and experience of chronic pain with the audience.
Thank you for having me on. And again, when they go to my website, by the way, I mean about skin, about respiratory, you name it. We're showcased so many incredible recovery testimonials, recovery stories of patients on there for many different conditions. So if they look around, they'll see, how great it really is. And I appreciate you having me on. I really do. Hopefully I was able to give good insight to your listeners. And it's all about getting health back and being able to keep our health and live longer with quality years.
Yeah.
So thank you so much for having me on.
No, it's been a pleasure. So that's all from Dr. Herman and me for this week. But don't forget, you can join me same time, same place next week podcast. Thanks for tuning in. Remember to give the show a rating and a review, and I'll see you next time.